We're here at Community Care Chemist in High Street in Belmont, where they've got a special evening for their VIP members so that they can find out more about traditional and natural medications. And I'm joined with Gerald Quigley here at the Community Care Chemist in Belmont, pharmacist and master herbalist. Can you tell us a little bit about your work?
I, Meryl, unlike probably a lot of health practitioners, try and focus on people who are well and try and have them understand that the illness model, which we commonly accept as the only model, is probably not the healthiest model that we should be chasing. So even if you do have some sort of chronic disease, osteoarthritis or whatever, there's lots you can do, lots and lots you can do to maintain, restore, recover your quality of life. So even though things aren't travelling all that well, you don't have to sit around and be sorry for yourself. You can intervene with food, you can intervene with natural therapies, with herbs, with minerals, with some good advice, and it is surprising. Once anybody is given those options and they take up some of them, how things can change.
So how do we correspond the traditional medicine and our healthy way of living?
We call it integrating. So integrating both modalities isn't all that difficult, because when you really look at a lot of the prescribed medicines, they play a very important role, but many of them can introduce nutritional deficiencies. Let me give you an example. If you take a cholesterol-lowering medicine, which half the Australian population takes, it's been well documented, well researched, well proven that there's a nutrient called coenzyme Q10, which we all have, which is responsible for helping us maintain energy, which is actually blocked from being produced by those medicines. So an obvious integrative thing to do is, if you're taking a statin, consider using coenzyme Q10, because you're in fact replacing the energy that the cholesterol-lowering medicine is taking away. That's so obvious, but many folk don't get the opportunity to understand that they can do it. So I think it's incumbent on pharmacists, and for that matter doctors, to at least give the option. It's up to the patient to decide. But if I was trying to keep my cholesterol down, I'd be looking for every dietary intervention I could possibly do. I'd be trying to understand the role of exercise. And if taking something simple like coenzyme Q10 meant that I didn't have a fuzzy brain or aches in my legs, I'd be taking it.
So for people that aren't able to be at this evening tonight, where would they start to get that information if they, we're wanting to find out more?
There's a couple of places where you can get good information. Obviously, your local face-to-face healthcare practitioner is the place to start. The other place to start is that wonderful 24 hours a day, 7 days a week doctor called Dr. Google. And a lot of that is often someone's opinion, but at least you can do some reading, you can be informed. What we want, what I would like to see, is as many Australians as possible become empowered to look after themselves, because frankly our system is heading down a pathway that we won't be able to afford to look after people who have no other option, where most of us do have options, and it would be great if we were given that information. Interesting, in some countries, New Zealand for instance, doctors there write what they call a green prescription, which means it's a prescribed exercise pattern. So the doctor says, now Mrs. Jones, I'd like you to walk for half an hour every day, and I'm expecting that you do that, and would you mind actually ticking the boxes when each... So there's some accountability. Now that's unheard of in Australia, which is quite silly.
Well, that's right. We need to take the charge ourselves for our own health, don't we? But of course, I suppose you need to be wary of Google information. How do you follow up and make sure that you're doing the right thing?
Before you make a decision, you ask, but at least get some background information. And again, if it seems too good to be true, it's usually not true. If it seems not to quite make sense, it probably doesn't make sense. So we're not all silly, and I think that sometimes we are so busy being told what we have to do, we're not actually given the opportunity to do that. So a few little things ourselves. There's no penalty for being informed. And I think it's really when people begin to understand that they can find some information themselves, and there's lots of good books somewhere on the internet, there's no excuse for information not being supplied.
Now, just tell us a little bit as well about your background. You've been involved a lot in radio and you're an author. Can you tell us a bit about that?
I've written a book on olive leaf extract, which is a fascinating herb. It's been shown clinically to prevent pre-diabetic men from proceeding into full-blown type 2 diabetes. I've been a pharmacist 45 years, so that makes me pretty old. But I said to my wife a few years after we graduated that I was really frustrated in the practice that we own, seeing the same people with the same diseases and the same conditions and the same quality of life month after month after month when they rolled in to get their prescriptions. So we made a bit of a deal, and Philippa, my wife, looked after the dispensing side, and I in fact spent my day helping people understand that they could intervene in their health if they wanted to. And that's how it all started.
Well, obviously you're doing the right thing because you don't look like you could have been in that field for 45 years.
Well, I must age well, but I think that most healthcare practitioners these days are really desperate to try and do the right thing. They're being restricted in so many ways from making and helping people make decisions about their health because of all sorts of rules and things, but it should be all about the patient. It should be the patient telling us what they expect us to do, not the other way around, which is what it appears to be.
Now, if someone was really interested in finding out more about you and getting onto your information, how could they do that?
Best way to get in contact with me is to just go to my website, which is just very simple, geraldquigley.com. I usually make a promise that I will reply to a contact me within 24 hours. That puts a bit of a burden sometimes, tests the relationship at home a little bit sometimes if I'm in my study. But I think if someone takes care enough to send you a request for help, and that usually they are requests for help, it's incumbent on me to get back to them as soon as I can.
Well, all the onus really should be on us, isn't it? And it's really, really simple, the old basics that we often forget.
The simpler health is so complicated these days. Everything, conception's complicated, pregnancy's complicated, every single thing, and it doesn't need to be. We've just got to look at the simplest outcome that does no harm, because the whole principle is you do no harm first. And I sometimes wonder if we go down the medical pathway too quickly, we can potentially do some harm.
A really exciting night here in Belmont. We've got a special guest for all of your VIP members.
We've got Gerald Quigley here with us, who is a pharmacist and master herbalist. Here at Community Chemist, we like to... I've got to start all over.
That's all right.
No worries. No problem.
That's okay. Yep. Start again? All right, ready. We're joined with Julie Ryan, the CEO of Community Care Chemist and Friendly Society. And we've got a really special evening tonight for your VIP members. Can you tell us what it's all about?
Yes, so tonight Community Care Chemist likes to reward our special members who support our community organisation. Community Care Chemist is a not-for-profit organisation, and we invest money back into our community. So we're here tonight for our members to give them an opportunity to talk to Gerald Quigley and to talk about issues that they've got and how they choose between complementary healthcare and how it can fit in with traditional medicine as well.
So it's wonderful Community Care Chemists are able to give their members this sort of evening so that they can get more information. What are some other benefits about being a member of the Community Care Chemist?
Well, Community Care Chemist, as I mentioned previously, is a not-for-profit organisation. So we run like any other business, except that our profits are either reinvested back into the business and into the communities in which we operate.
From Community Care Chemist in Belmont, Meryl Friend, News Geelong.